Welcome to this no-cost continuing education for pharmacy technicians. The title of our presentation will be Expanding the Pharmacy Technician's Impact, Opioid Misuse and Overdose Prevention. We'll talk you through how the pharmacy technician can increase their initiatives within the pharmacy in order to play an integral role in prevention of opioid misuse and accidental overdose. My name is Heidi Uckel, and I will be walking you through this training. I am a faculty member at North Dakota State University School of Pharmacy and was also one of the initiating investigators on the 1Rx program. We now are changing our name to the One program to be more inclusive of non-pharmacy initiatives. So you'll hear me refer it to the One program now instead of 1Rx. My contact information is listed on this slide for you. Please reach out and email with any and all questions that might arise. Today, we'll be working through a set of objectives. These objectives include applying concepts to actively communicate with patients to assess for safe opioid use. We will learn how to identify the need for pharmacist intervention based on patient response to opioid screening results. You'll learn how to provide follow-up education on medication disposal for safe opioid use, and using standardized tools, screen patients for opioid safety 3 to 5 days after opioid therapy initiation. I want to take a brief moment to allow you to scan this QR code that's on the screen in order to take a survey. This survey will help us to determine the areas that we need to focus on more in future initiatives and also outreach to those of you who are participating in this program. Go ahead and pause this recording, complete the survey, and then jump back in and we'll continue with our training. Now that you've completed this survey, I do want to take just a little bit of time to go through some background information on opioid statistics. I'm sure you are all very well aware of the opioid crisis across the nation and how it has affected not only your patients, but also the practice that practice at your current pharmacy worksite. Throughout the last 10 to 15 years, we've had major new initiatives that have changed the landscape of our pharmacies. We have a PDMP, or the Prescription Drug Monitoring Program. We have opioid prescribing suggestions for our prescribers. We have pain contracts. So there are many, many things that lots of different entities are doing in order to help combat this opioid crisis. Nearly half of all opioid deaths involve a prescription opioid. That is a pretty astonishing statistic from the Centers for Disease Control. Many of those abusing prescription opioids or even heroin had a prescription medication as their entry point. These might be a prescription for themselves or a prescription that they started using from a family member or friend. This is a very sad statistic because when we as pharmacy personnel give out a prescription, we are hopeful that that prescription will help the patient, not harm the patient. So it is alarming to see this entry point of drug abuse through a medication that's essentially deemed necessary for pain control. Among post-op patients, 92% received an opioid prescription, but 63% of those pills went unused, and 1/3 of the patients used absolutely none of those prescriptions. So this is also an astonishing statistic because we are giving these medications out. A lot of it's going unused, and then that unused portion is fueling the opioid crisis across the nation. Let's talk just briefly about the etiology of prescription opioid misuse. The disease concept of substance use disorders is that individuals who suffer from the disease absolutely do not choose to contract the disease any more than someone who suffers from heart disease or diabetes mellitus chooses to contract that illness. There are basic underlying issues that can lead to substance use disorders. Though individuals choose to use a substance initially, Biological changes in the brain's motivation and reward systems in the brain caused by chronic use may perpetuate use due to the development of cravings. The Opioid and Naloxone Education Program has been instituted in pharmacies across the state of North Dakota. We have nearly 40 pharmacies that are actively screening all patients for opioid misuse risk when any opioid prescription is filled. This is something that is unique to the state of North Dakota and is truly changing workflow and the impact that pharmacy can have on the opioid crisis. Additional states have reached out to us to start the initiative. Idaho is steps away from launching, and even West Virginia has reached out to start the ONE program across their state community pharmacies as well. We are very, very excited to be able to offer an additional step for the pharmacy technician to increase their role in the opioid crisis and further serve the patients of their pharmacy. I'm just going to take a minute to refresh your mind on what OneRx stands for and what we do, and then we'll launch right into your role in the ONE program and how you can further combat that opioid crisis that exists across our state. Through the ONE program, the process starts with the receiving of an opioid prescription at the community pharmacy level. Once that prescription is received, the patient completes a brief screening form. That screening assesses for the risk of opioid misuse and also for the risk of accidental overdose. Based on that risk assessment, pharmacists provide specific interventions. Those interventions are based on the objective scores for that risk screening. The interventions include partial filling of an opioid prescription, recommending and encouraging medication take-back programs, the discussion and prescribing and dispensing of naloxone, referral to community support services, and opioid misuse risk consultation. During the screening, our pharmacists are looking to see if the patient falls into one of two buckets. We are screening for patients that might be at risk for opioid misuse and also for patients who might be at risk of opioid overdose. The opioid misuse risk takes into account personal and family history, which signals that the patient might misuse their medication. So might use the medication more than is prescribed or not exactly as prescribed. That can lead to opioid misuse or substance use disorders. In the other bucket, our pharmacists are screening for opioid overdose. So overdose is the chance, even if the patient is using their medication exactly as prescribed, it's the chance that that patient might overdose on their medications. And this would be based on the use of other medications that might increase that risk, of current disease states like asthma or COPD, which might increase their risk of overdose, and the use of other over-the-counter medications. So that is what the screening form assesses for, and then our pharmacists are able to determine what interventions are offered based on that screening risk outcome. Our pharmacies across the state are making a huge impact on the health and welfare of the patients across the state who need an opioid medication. We currently have 44 OneRx pharmacies. Over 8,500 patients have been screened over the course of 2.5 years. Of those, 18% are at risk of overdose, and 4% were identified at risk of opioid misuse. 26% of those, when indicated, receive naloxone. This is a huge statistic. Across the nation, about 1.5% of patients needing naloxone are given it, and you are providing naloxone to 26% of those who need it. So this is just absolutely awesome. You guys are helping the right people. Through our statistics, we've been able to show that of those at risk of falling into one of those two buckets, misuse or overdose, 78% received one or more critical intervention. And we signify critical interventions as naloxone benefits, dispensing of naloxone, contacting the provider, and then discussing misuse risk, overdose, and or community support services. So these are just fantastic things that pharmacies and the community level are doing for our patients across the state of North Dakota. The ONE program starts with the initiation of an opioid prescription. So once an opioid prescription is received at the pharmacy will perform a screening for each patient that receives an opioid prescription. That screening will screen for the risk of opioid misuse and also the risk of accidental overdose. Based on the objective screening, if there is a positive risk for opioid misuse and or a positive risk for accidental overdose, interventions will be provided to the patient from the pharmacist. Interventions are based on clinical judgment as well as the risk stratification level. The interventions include partial filling of the opioid medication, education about medication take-back programs, discussion, prescribing and dispensing of naloxone, referral, like to the Community Support Service Network, and opioid misuse risk consultation. We will be taking this one step further with this exciting new program. So again, instead of turning the patient away and hoping for the best, we will be following up with that patient 3 days after the opioid has been started to look for additional opportunities for education and intervention. This program is for the technician to check in with the patient to ensure opioid therapy is completed safely. DocStation is the platform that will be used for this program. DocStation is an online platform that is the program that is currently used for all of the ONE screenings. Within DocStation, a follow-up task will be initiated 3 days after that ONE program screening. The pharmacy technician or any other necessary personnel in the pharmacy will contact the patient via telephone. That individual will ask 4 key questions, which also guides the technician through a consult. There will be $10 reimbursed to the pharmacy for every completed follow-up screening. This is an exciting opportunity for pharmacy technicians in the state of North Dakota to take an advanced role in patient care and also earn additional reimbursement for pharmacy services. This is an innovative program across the nation, and we're very excited to see what you can do with it. These 4-question follow-up interventions are very, very straightforward. You'll see them here on the screen. Are you still needing an opioid for safe pain relief? Are you experiencing any side effects with your pain medication? Have you found yourself needing to take more of this medication than what the directions state? And do you have any questions for the pharmacist? Number 1 includes an opportunity for technician-delivered education, which is pretty exciting for the world of pharmacy in the state of North Dakota. We'll learn more about that in the upcoming slides. You'll see here what we call a triage tool. So the 4 questions are outlined for you in the 4 yellow boxes. The first question, are you still using an opioid medication to relieve your pain? Yes or no? If the patient says yes, the technician will deliver education on disposal options and storage. If they answer no and they still have some remaining, the pharmacy technician will deliver education again on disposal options. Numbers 2, 3, and 4, the pharmacy technician will ask the questions. Are you experiencing any side effects? Are you using more medication than prescribed? And do you have any questions for the pharmacist? If any of those are yes, then that patient would be put on hold and asked to speak with the pharmacist. So again, that top question provides a great opportunity for technician-delivered education. The next few slides, I will walk you through some of that education so that you can provide evidence-based and robust education for our patients on opioid safety in regards to medication disposal and medication storage. The North Dakota Department of Human Services has an initiative called Filled with Awareness. I just wanted to share this information with you as it really builds a nice framework for the technician-delivered education for medication storage and medication disposal that you'll be offering through these follow-up phone calls. Statistics across the state of North Dakota show that a total of 65% of people have reported retaining some or all opioids, even if they stop taking the medication, and some accumulated very large amounts of these medications. A total of 34% of people described engaging in sharing or diversion of opioids at least once, most often receiving them from a family member or a friend. 53% of people who abuse prescription pain relievers obtain them from a friend or a relative. So unused opioids are a gateway for opioid misuse and furthering along that opioid crisis in our state. The Fill with Awareness campaign includes Lock, Monitor, and Take Back. Those are the three key initiatives that the Department of Health has decided to further promote. Lock. Keep medication out of sight and in a safe and secure place. This includes out of sight of family members and friends, not just out of sight and reach of children. Monitor. Keep track of medication and take it only as directed. Take back. Drop off unused medication at local take-back locations. Medication take-back or disposal can be done at home safely, as well as at the pharmacy or police stations. In the next slide, you'll learn a little bit about the appropriate ways to dispose of medications. This is specific in our training for opioid medications. You will be asking patients if they have any opioid medication remaining that they're not using. It will be very important that you instruct them to dispose of any unused opioids and explain why. It's for the safety of them and their family members and friends, because 53% of patients who abuse prescription pain relievers obtain them from a friend or relative who's not using them.
Some things in your medicine cabinet are more dangerous than others. When it comes to prescription drugs, opioid pain medicines can be addictive and even deadly. Keeping unused opioid medicines in your home is risky. Half the people who misuse prescription pain medicines get them from a friend or family member. Over 100 Americans die every day from an opioid overdose, and millions are addicted to opioids. But you can be part of the solution to the opioid crisis. Go through your medicine cabinets, drawers, anywhere you keep unused opioid pills, patches, or syrups, and find out how to dispose of them safely. Visit fda.gov/drug disposal for details and remove the risk of opioids in your home.
Unused prescription opioid pain medicines can spell many things. Risk if they're taken by someone they weren't prescribed for. Harm if accidentally taken by a child or a pet. And overdose if they're not used as directed. They may be hiding in your home, in bathrooms, kitchens, or anywhere. Why put your family at risk? Safely dispose of opioids before they can do harm. The best thing is to find a drug take-back option, such as medicine drop-off boxes, mail-back programs, or home disposal products. If there isn't a take-back location near you, check the FDA's flush list. Medicines on the flush list may be especially dangerous if they are used by children, pets, or others in your home. No take-back location nearby and your medicine isn't on the flush list? You can dispose of it in the trash. Get more information on safe opioid disposal and remove the risk.
As you saw in the brief video, there are many ways to safely dispose of medications. The best one, it would be to use the MedSafe at your pharmacy. The North Dakota Board of Pharmacy offers MedSafe services to every pharmacy at no cost. If you don't have one, contact the Board of Pharmacy and they'll hook you up. The next is the Deterra bag. Deterra bags are inert drug deactivation bags that can be sent home with a patient. We would suggest sending one of these home with patients that are using an opioid medication. The contact information for the Department of Health person that could send Deterra bags to you in your pharmacy is listed on the screen for you. Patients could also bring their unused medication back to a local public health unit or a police station. If none of these options are available, patients can use the trash. I'll just refresh your mind from the video that we would want our patients to remove the medication from their original containers and mix it with something undesirable, such as used coffee grounds, dirt, or cat litter. This makes the medication less appealing to children and pets and unrecognizable for someone who might intentionally go through the trash looking for these medications. We then ask the patient to put the mixture in something they could close, like a resealable zipper storage bag, an empty can, another container, to prevent the drug from leaking or spilling out, and then to throw that container in the garbage. On the slide is a link to the FDA's website on where and how to dispose of unused medications if you want further information on this above and beyond the video that was provided. We've talked about medication disposal, so getting rid of unused opioids so patients, family, and friends don't utilize those in an unnecessary or unsafe way. When the patient is using their opioid medication, they should be storing this medication in a safe place to avoid diversion and accidental use. So diversion is actually someone coming in and taking someone's opioid medication even if the patient still needs it. This can happen in households. It can happen during an open house. It can happen during a family party. So it's very important that opioids specifically are stored in a safe, designated area. The best scenario would be to use a medication lockbox, although this is not always an option. If it's a patient using a chronic opioid, I would suggest a lockbox all of the time. If it's for short-term use, a lockbox is probably not necessary. We would just want to instruct our patients to store in a safe, designated area. So this needs to be out of the reach of children or pets and out of sights of visitors to the home. The opioid medication should be stored in a designated area. So not on the side table next to a rocking chair, not on the kitchen counter. This needs to be somewhere out of sight, as well as in an area that is safe for medication storage. So again, looking at those 4 questions and kind of this triage tool, you'll be given that opportunity to deliver education to our patients on opioid disposal and medication storage options. So let's take a look at the actual screening questionnaire. This will be automatically populated in DocStation for you. So when you make the phone calls, you can simply click through it in DocStation. If there's not a computer available to you when you make the calls, there is a paper form available on our website as well that you can certainly use and then enter into DocStation later. This is what the screening form looks like. Number 1, are you still needing an opioid for pain relief? If the answer is no, then the pharmacy technician would ask, do you have any old opioids left over? If they say yes, you would remind them of disposal options like Deterra and MedSafe, and then ask them how will they dispose of their remaining medications. Deterra bag, at the pharmacy, or other, and then you'll document that. If they are still needing an opioid for pain relief, you would remind the patient of safe medication storage. So out of the reach of children and pets, out of view of any visitors, and in a designated area. So not out and about, somewhere that's designated for medications. And then remind the patient of the importance of medication disposal. So something like, once you're done with this medication, remember that it does need to be disposed of if you have any left. It can be unsafe to keep this in the home, as that can often lead to harm to your friends or family members. And then ask them, once you are finished with this medication, if you have any left, how will you dispose of that medication? The doTERRA bag at the pharmacy or other is listed there as well. Number 2, have you experienced any side effects with your pain medication? If they say no, you'll proceed on. Have you found yourself needing to take more of this medication than what the directions state? If they say no, again, you'd proceed on. And do you have any questions for the pharmacist? If the patient answers yes to questions 2 through 4, state, "Thank you, I'd like to have the pharmacist speak with you a moment to address some of the information you provided. Would you please hold?" And then you would call the pharmacist over, give them just a brief heads up. This patient stated they are experiencing some side effects from the medication and they'd like to speak with you. I would suggest asking all 4 questions before getting the pharmacist involved, as if they have answers to yes on more than one of the bottom 3 questions, you would want the pharmacist to be able to address all of those. Now that you've learned a little bit about what the project entails and your role in this program, I want to talk a little bit about the more minute details of the program. The follow-up program will be housed completely in DocStation. DocStation is the online patient care program that you are currently submitting your one claims through. This DocStation platform will track all of your activity for the one program. After a one program screening is input into DocStation, an automatic task will be generated on day 3 after that one screening. It will be available in DocStation until day 7 after the one screening has been performed. So imagine that you provided a one screening on January 1st. That task would be generated on January 4th and available until January 8th. It's very important that you're documenting your patient screenings in DocStation on the day that they occur, so that the follow-up program can occur when it is most appropriate for that patient. There's a help document located on DocStation's website, and I've also uploaded a QR code so that you can scan that to view the help document. All of our help documents will also be uploaded on the One Program website in the Technician Follow-Up Program site as well.
Hello and welcome to DocStation. In this tutorial, I will demonstrate how to address the pharmacy technician-focused one program screening follow-up task. To begin, we will navigate to the patient list to identify those patients that have been targeted with this follow-up task. The easiest way to do that is through the North Dakota One Program task card on your dashboard here. If we hover over tasks addressed, we can see a link to the unaddressed tasks. Next, we'll filter our task type to the One Program screening follow-up, and we'll immediately see the patient list filtered to just those members who have already been targeted with this screening follow-up. Then, we will select which patient we'd like to follow up with and click on the tasks icon. Now, the One Program screening follow-up is here in the task list. This is automatically generated based on the original One Program screening that is performed by the pharmacist at the initial dispense. That is fully covered in detail in another tutorial, but as a quick reminder, you can access that task through the on-demand task and choose the One Program screening and the related medication here to add this task. The One Program screening follow-up task will be automatically generated after the One Program screening task identifies that this is the first time this patient has ever filled this medication. So this here, the answer yes to this, is a trigger for the One Program screening follow-up. And this follow-up task will pop into workflow 3 days after this One Program screening is completed, and will be available to complete for up to a week past that date. We'll go ahead and close this One Program screening. So to engage with the One Program screening follow-up, the technician can simply click Start. Once they've got the patient on the line, they can begin the assessment. The related medication for whatever we're following up on here is listed here and can be accessed here if you'd like to add additional information there. Click on Begin Follow-Up Assessment. There are 4 basic questions contained in the follow-up assessment, and depending on how the patient answers the first couple of questions, additional questions will pop in. So to begin, we'll ask the question, do you still need an opioid for pain relief? If the patient says yes, they are still taking it, then we can kindly remind them of the safe disposal options and of safe medication storage. Then the question remains, when you are done with treatment, which of the medication disposal options are you likely to choose? And this again is if they end up having remaining opioids at that time. We can select Deterra, MedSafe, at pharmacy, other, all of the above, and you can certainly unselect any of these. If this question is present, you must select one of them, one of the options, to be able to complete the assessment in its entirety. If the patient says they do not need an opioid for pain relief, then we ask the question, do you have any opioids left over? If they say yes, then again we will remind the patient of safe disposal options and select whichever that they state they are likely to choose. Again, if this question is present in the assessment, an answer must be contained in the assessment to be able to complete the task. If the patient has no opioids left over, we can simply select no and collect that data. The next question is, have you experienced any side effects with your pain medication? If they say yes, then we will allow the opportunity to refer them to a pharmacist for counsel. If they say no, we'll just collect that data. And the next 2 questions operate very similarly as well. Have you found yourself needing to take more of this medication than what the directions say? Yes, we'll refer to pharmacist for counsel, or no. And do you have any questions for the pharmacist? Yes, obviously, we will then refer them to the pharmacist for counsel, or no, and we will collect that data. Once all of the questions have been responded to, we can select Done, and we'll see the blue check mark here that the follow-up assessment is complete. This is all that remains to complete this screening follow-up task. We can click Continue. If needed, we can select to generate an e-care plan, but it is not required at this time. So we can simply click Continue, and we'll see the task is now completed here. If for some reason one of these questions went wrong, or you need to make a change, at this time, before you navigate away from this screen, you can still undo the task and make whatever changes are needed. We'll see that task undone. Once the task is complete, it will move into the patient's task history here, where it can be reviewed as well. More information about the benefits of the One Program Screening Follow-Up task will be available from the One Program administrators. Thank you.
Let's now dive into 2 separate cases. These cases will illustrate for you the conversation between a pharmacy technician and a patient in regards to their opioid medication 3 days after receiving their prescription.
Hi Jill, this is Laura with the medicine shop.
Hi.
Say, I noticed that you were prescribed some hydrocodone acetaminophen the other day, and I was wondering, did you still have any of that left?
Why?
I was just making sure that if you did have any left, if you needed it, and if you didn't, just to make sure that you were aware of proper medication disposal.
Oh, okay. Yeah, I actually do have some left, but I'm not using it anymore.
Okay, did you find that the dose worked for you, or you didn't need it, or?
I actually was just taking Tylenol, and that was controlling it well enough that I didn't think I needed to take that narcotic.
Okay, so our proper medication disposal, there's a few different ways. You can certainly use whichever one is most convenient for you. At the pharmacy, we do have a MedSafe. It's a blue metal box, kind of like a mailbox that you just slip your medications in. There's also a Deterra bag that you put the medications, you open it up and you put the medications in there, and it makes them dissolve, and you can throw that away. Otherwise, there's also the public health or the police station. You can also put it in the trash, but make sure that you open it up and remove it from the bottle and put it in something unsavory like kitty litter, eggshells, coffee grounds, that kind of thing. Just be sure not to flush it. Make sure you just put it in the trash.
Okay, I think I'll probably do the trash option.
Okay, well, thank you for your time.
Thank you. Bye-bye.
Hi, Jill. This is Laura with the Medicine Shop.
Hi, Laura.
Say, I noticed the other day you picked up an opioid for pain relief, and I was wondering if you are still taking that, or how's that going for you?
Yeah, I'm still taking it. I still need it.
Okay, and did you find that you're experiencing any side effects with this at all?
I don't think so.
Okay, so no like dizziness, drowsiness, constipation, anything like that?
I guess now that you mention it, maybe a little constipation.
Okay, well, before we hang up, I'll have you chat with our pharmacist about that. Would that be okay with you?
Yes, I actually would like that.
Okay, and as the prescription is written, is that effective for you? Do you find like you might need to take more or less?
No, I'm just taking it just how it says on the label, and it's been working for me well.
Okay, great. I was also wanting to make sure that you are aware of medication disposal and or storage. Since you're still using it, we should talk about the storage.
Okay.
So you can do a couple of things. There's a lockbox. We sell those at the pharmacy. It has keys. It's like a little briefcase, and it's only accessible to you. And then another couple of options is to keep it in a safe designated area. So make sure it's out of reach of children or pets. And then also be sure when you have visitors that it's out of sight for visitors to your home.
Okay.
And then if you find that you're done, that Tylenol's working fine and you don't need it anymore, there's several ways that you can dispose of the medication. There's a med safe at the pharmacy. It's a little drop down door. You can just put your medicine bottles right in there. There's also a deterra bag where you would open the pharmacy bottle and put the contents in this bag, and it makes them undesirable, and then you can throw the bag away. We can send those home with you if you'd like. Otherwise, there's the local public health unit or the police station. And the final option would be to remove the drugs from their original container and mix them with something undesirable like coffee grounds, dirt, hair gel, something unsavory, and then seal it up and put it in the trash. Never put it down the drain or flush it. Make sure it's just sealed up in something unsavory, and then you can throw it away.
Okay,
Did
sounds
you have,
good.
Yeah, did you have any more questions about either of those things?
I don't think so.
Okay, I'll put you on a brief hold and connect you with the pharmacist.
Awesome, thank you.
Yeah, thank you for your time.
Bye-bye.
So now you've learned about the program, seen the documentation system, both paper-based and in DocStation, and heard 2 case examples. Here are some tools for success. The One Program website is a great way for you to get connected with all of the work that the One Program does, as well as many different tools to help you succeed. Here, you can sign your pharmacy up for the One Program. You can access all training videos. There are FAQ documents and also access to print any documents you might need. My email address is listed for you. Please reach out with any and all questions as you move through this exciting new follow-up program. And finally, a few tips for success. First and foremost, make sure that you're logging into DocStation daily to check for the tasks that are being generated for you. Set aside time for making calls and entering data. It's important that you enter your One screenings on the day that they're performed so that the follow-up can be triggered on that day that it's most appropriate for the patient. And then finally, contact the One Program with any and all questions. We look forward to this exciting initiative and the increased role it will put for you and in your workplace, as well as the advanced care it will provide for the patients of North Dakota.